Greetings, everyone, and thank you for joining us. I'm Steve Shallett, Business Development Director with NJ Spotlight News. I'm standing in today for our founding editor, John Mooney, to introduce to you today's panel, which is part of our NJ Decides 21 Election Conversations series. This is the second of 5 events. Today's topic will be COVID and healthcare in New Jersey. The conversation will discuss what the landscape in these topics might be like after the upcoming election. So we're very pleased to dig into a topic that's important to everyone. And we're excited to have an array of vast talent, which I'll announce in just a moment. Before we get started, I'd like to just give us a couple of housekeeping tips here. Firstly, you're in the Vimeo environment. There's a chat window there. We encourage you to use it, both with the intent of submitting questions, but also to converse with one another. We found that that's a great way to kind of round out and involve people in the conversation. Also, please use your social media channels. We are using the hashtag NJDecides, and tag NJ Spotlight News. I'd like to also say that after the panel, which will conclude at 1 o'clock, we will have a brief after party in the chat room on Vimeo, where you can converse with some of our panelists and Lilo and Brenda, who will stay on as to moderate and speak with you there. We're excited to kind of involve everybody as much as we can and have this be a fruitful and wide-ranging discussion. These events are not possible without the support of our sponsors, and I'd like to briefly say a few remarks on behalf of today's sponsor, which is the New Jersey Education Association, which is a diverse, democratic organization that works to create an optimal environment for achieving excellence in public education in New Jersey. The NJEA's mission is to advance and protect the rights, benefits, and interests of members, and to promote an excellent system of public education for all students. The NJEA promotes and delivers quality professional development for educators and advances and supports policies that enhance and enrich public education in New Jersey. So our appreciation to the NJEA. So we're moving very quickly. If I may, I would like to announce our panelists. Joining us today is Dr. Sharif El-Nahal, who is the president and CEO of University Hospital in Newark. We also know him well as the former commissioner of Department of Health in New Jersey. So welcome, Dr. El-Nahal. Thank you. Also joining us is Dr. Perry Halkitis. He is the dean of Rutgers School of Public Health. Thank you for joining us, Dr. Halkitis. Joining us also is Dr. Annette Riboli, who is the dean of the Cooper Medical School at Rowan University. So very pleased to have Dr. Riboli as well. Rounding out our speakers today will be the moderators. These are 2 of our journalists with NJ Spotlight News. Firstly is Brenda Flanagan, who is a correspondent with NJ Spotlight News, and also the healthcare writer for NJ Spotlight News, Lilo H. Stainton. So with that, I'd like to turn it over to Brenda and Lilo to introduce our topic and get us going and introduce our panelists to the conversation. And again, thank you for joining us, and on with our program. Lilo?
Welcome, everybody. This is going to be a good discussion. So obviously, as everybody here knows, the pandemic has changed pretty much everything in our lives over the last 19 months or more. And that certainly includes elections, both from the way we vote to what we care about when we go to the ballot box, the proverbial ballot box. The governor has obviously played a huge role in creating state policy and setting the response in the pandemic. So it's important to talk about what the next chief executive needs to be thinking about. We will talk about the state's response to COVID and what that means and what voters should think about as they interpret those events that have taken place. We'll talk about the impact of science and politics on public policy, and hopefully have time for some other relevant topics as well. We do look forward to your questions. We will weave them in whenever possible. I urge people to think of questions in terms of the election, not just things you want to know or might want to hear from the panelists, but questions they can answer that would inform other voters on the subjects that we're discussing. And so with that, I first want to talk to my my co-panelist Brenda Flanagan, who my partner in crime here today, who has actually won an award for her frontline coverage during the pandemic. And, we have seen a lot of strange things as reporters covering campaigns over the years. But Brenda, tell me, what strikes you most about the pandemic and the pandemic as a campaign issue?
I think I was talking about the fact that this has been a campaign that's integral to the pandemic more than a lot of other issues that you'd normally see crop up in campaigns. And I think what I'm going to do, since this seems to be an uncertain connection, I'm going to jump right into the questions, if that's all right. So I'm going to direct questions, but please feel free to jump in, panelists, all right? Jersey tends to focus traditionally on things like taxes and education, but this year we're seeing grassroots groups, we're seeing political action committees forming to support local legislative candidates, for example, talking about vaccination, talking about masking, and there are protests that are loud and very, very emotional. So how much is the pandemic factoring into this election, and what's at stake for voters? I'm going to ask Dean Halkitis to weigh in on this first.
Yeah, thank you, Brenda. It's such an honor to be here with all my colleagues and all of you. And I think that, like any election, the circumstances of this election are shaped by the societal conditions. So, if we think about the '60s and Vietnam, if we think about 1918, if we think about the Great Depression, never do elections happen separate from what is happening in the rest of our country. So, what I think we're seeing right now in our country is something that I think is a healthy reaction in some ways, right? Which is people really organizing on one side or another and taking a stand and making their ideas and feelings heard. So it's of course shaping the election. My concern, Brenda, and I think probably this is shared by my colleagues, is that often those decisions and often those motivations and often those approaches to dealing with a pandemic, whether it be masks in schools or vaccination, are not directed by science. And what I'm hoping we'll be able to talk about here today collectively is how we need to let science direct us and not let our emotional lives take over and control our decision making when the data in front of us are also clear.
Absolutely.
I couldn't agree more with what was just stated. I would also add to the role that social media is playing in this. And, spread of misinformation, which has been quite disconcerting. So I think following the evidence base in medicine, we try to do that. We educate our students to do that. And following the science is going to be the key.
I think it's difficult sometimes, though, because you have social media that will even take news pieces and use them in a way that isn't a balanced presentation to try and score a political point on a pandemic issue. How does a voter focus on what's right as opposed to what emotionally or politically the angle?
I would say educate yourself and listen to the experts, the public health experts, the medical experts, and just try to block out things that do not sound correct, that advocate for medications that aren't tested. So try to concentrate on sound scientific information from true authorities in the field.
Sure. Did you want to add?
Yeah, I'm happy to offer some thoughts here. So I think what people are seeing now is a tension between the government's responsibility to keep people safe and the government's responsibility to protect your constitutional freedoms, both of which are extremely important. Here's how I think about it, just having the perspective of running a hospital that was filled up with patients with COVID-19 and unfortunately continuing to see people being admitted and dying from this disease. The virus strips away your freedom too. And A lot of folks who advocate for the freedom to not wear a mask, the freedom to, continue to go to work in person without being vaccinated or taking some of these precautions. A lot of those folks, unfortunately, end up in the hospital and express regret for not having taken these safety precautions. And so I think we have to think about this in terms of a hierarchy of needs and a hierarchy of risks to the population. I know that the governor, having worked with him when I was health commissioner, considers both things important. But I also think that all politicians consider both things important. And the question really becomes how you sort of rank these priorities. In my view, the risk of you compromising somebody else, in addition to compromising yourself if you don't wear a mask or if you don't get vaccinated, is also a unique factor here. The importance of the collective in protecting safety and protecting health really should be considered, in my view, and is a nuance that I think is important when you're threading these fundamental questions. Of course, people consider their freedoms extremely important, as they should. But I think that viewpoint sometimes underweights the risk of actually getting COVID-19 and the Delta variant of COVID-19, which is more likely to place you in the hospital and more likely to kill you, especially if you are not vaccinated.
Can I add something to what Sharif is saying? Because I think that is a very critical point here, which is people, we do not exist in isolation. People are in couples. People are in families, people are in communities, people are in towns, people are in states, people are in countries. And each of those contexts provide us something. The government provides us protections, highways, and what have you. When you enter into this, this agreement, with the government, that you are going to get these services, you also have a responsibility for the other people who have joined into that agreement also. And so what Dr. El-Nahar is saying is, I couldn't agree with what he's saying more, which is you don't just have a responsibility to yourself, but you have a responsibility to your fellow New Jerseyans in making sure that they don't get sick, that they do not die.
One of the places that the government played an extreme role during the pandemic, of course, was one of the places where the risk was the highest, nursing homes, right? The state and Governor Murphy in particular, and the current health commissioner have received a lot of criticism for some of the decisions they made around that. Dr. El-Nahar, tell us what should people know about those choices when they assess what they hear about what happens or what is happening in nursing homes? What do people need to know?
Well, the first thing I'll say, Lilo, is that I think there's a collective understanding that what happened in nursing homes in New Jersey was, really tragic. The fact that we had so many deaths and we had so many nursing homes overwhelmed with outbreaks is, really just something that we should all seek to learn from and avoid in the future. A couple pieces of context I think are important here. So when I was in the seat of health commissioner, even before the pandemic, nursing homes were a big part of my attention in the context of a devastating outbreak at a pediatric nursing home that unfortunately took the lives of so many kids. And it was at that point when I had to learn firsthand that the infrastructure at baseline for long-term care in the state, not just for pediatric nursing homes, but across the industry, as it is obvious now, is not up to date with current standards. And the robustness of infection control training and plans in the events of outbreaks, just that infrastructure wasn't there. And I know that there's been significant reform, especially since the pandemic, on making sure that outbreak plans are in place going forward, that there's a clear plan in place, each of which are reviewed by the Department of Health. And it's important to also understand that these folks have been working around the clock at the Department of Health, including our commissioner, 24/7. And I know that firsthand because we're part of the response team as a level 1 trauma center in the northern region. And so, that's been a collaborative working relationship. But ultimately, the infrastructure was not ready for such a devastating virus. Another piece of context is you have to understand that there were multiple priorities for hospital capacity. And I'm sensitive to that because I run one right now. And I can tell you, we were probably days away from having to take the extraordinary step of rationing care. And so creating hospital capacity was elevated in everybody's mind as the first priority, because it's not like folks weren't having health problems that required hospital admissions other than COVID. In fact, we had evidence in Newark that about 50% of our calls found people already in severe condition or passed away, overwhelmingly people of color, unfortunately, in the city of Newark, because they were afraid to go to the hospital. But despite that, that doesn't mean the clinical need wasn't there. And so I can't think of a single person alive who had experience with a pandemic like this before this one. And so I think those pieces of context are important to understand. Now, I do think we're going to have to learn a lot. There needs to be an after-action review, as the state government has already committed to. But I thought I'd offer those two nuggets.
Thank you. That's good.
I think what I'd like to do is throw a question at Dr. Raboli, talking about the vaccine rollout. We had months to get that together, to plan, to make sure that it went smoothly. But the process actually was kind of challenged, which is a charitable description. If you remember hitting the refresh button at 3 a.m. So what are the lessons for future governors, for candidates here? What should voters be demanding from the candidates on this issue?
So first, I'd like to emphasize the outcome, okay, and where we are right now. So yes, there were some challenges, but ultimately, and I think that this should be a big point of pride, New Jersey ranks 6th in the country for vaccination of its population. We're a densely populated state, over 8.8 million citizens. To date, 5.6 million or so are fully vaccinated, and that rank is 6th. Our neighboring states, Pennsylvania and Delaware, are around 19 and 20. So I think that it's the outcome. Now, could the road have been a bit smoother? Certainly. But I think it's that outcome that counts. And, it was a great partnership. The public health authorities, the hospital systems stepped it up, the county health departments as well. There was a lot of effort that went into getting to this point. We have to center, too, on where we were in March of 2020. So in March of 2020, we didn't have any viable vaccines. The emergency use authorization would have been granted with a 70% efficacy. The vaccines came in the 90s. Amazing results. We also have never faced this type of a pandemic. I think one of my other panelists pointed out that this was totally uncharted territory. There was a lot that wasn't known. So there has been tremendous progress. And I think that New Jersey has ultimately done very well. The results of vaccinating, 63, 64% of the population fully vaccinated. Now, there's more to be done. And this is being tracked. I know this at the state level because I serve on a professional advisory to the Department of Health. But, they are making progress even in communities that have lesser vaccination rate. There's a lot of work being put into that.
Brenda, could I offer something? Can I offer something here? Is that allowed? So I again, my colleagues are, it's such an honor to be on this panel with them and to, share these ideas with them. What I think what we also forget is that things happened rapidly and people needed to be nimble, right? And so we can perceive it as one way, which is people are being indecisive and rules change. But I am old enough to remember the 1980s when HIV was in our mix and every day was a new piece of information we had to adjust, right? And so the fact that our governor and our government in our state was able to adjust as new information emerged is evidence that you're leading by science. And if we expect the answer that we had in April of 2020 to be the same as the answer we have in April of 2021, that's just not the way life works, and we all know it. And so the nimbleness, I think, has resulted in us being number 6.
Brenda, I'd like to. Oh, can I come back to one other point? So I work with students as the dean of a medical school and residents, so trainees, young people who are just starting their careers in medicine. And I have told them consistently since the start of the pandemic, this is going to test your tolerance for ambiguity, your emotional intelligence, your flexibility, your adaptability. And I would extend that to the general population too. It's a test for all of us. And as we learn more and more, yes, guidance will change. We have to accept that. It's the progress that we're making.
But let me.
To that end, vaccines have become a lot more politicized lately than they were even a year ago. So how do voters make sense out of this issue? Basically, how do you separate the science from the political rhetoric so that you can cast an informed vote? Harry, take it away.
I mean, I would say that first and foremost, you need to, look, let me step back and say this. We work from a place too often in health and in healthcare and in public health that assumes that human beings are rational operators. We all know, all of us on this panel know perfectly well that human beings make decisions based on emotions and feelings and what have you. So what I think we have to do, and what I think we have not done really effectively at the federal level, at the state level, as at the local level, is to appeal to people's emotional lives, appeal to people's sense of altruism, appeal to people's sense of worth and goodwill. Because I think that there is this perception that with more information, people are going to make the right decision. And we know that's not true. We know that information alone, if information alone was sufficient, nobody would smoke. If information alone was sufficient, everyone would wear a seatbelt. If information alone was sufficient, everyone would wear a condom. But that's not the case. People make decisions based on emotions. So I ask all of our folks here who are listening in today, for those people in your life who are hesitant, appeal to them, appeal to their emotional lives, appeal to their sense of duty to the people that they love and want to protect. And that's how I think we get the facts, the science to actually win out in the long end, in the long run.
I wonder, can I bring on a question from the audience here? Because one of our viewers is saying that she's critical of the narrative that just promotes vaccinations, and that the government and the media and the doctors ignore alternative regimens of, for example, healthy nutrition and lifestyle and home remedies. How do you react to that? Anybody?
Yeah, I'm happy to take that on. So this is a common refrain that we're hearing from folks who are skeptical of vaccination, but also skeptical of a lot of other safety protocols that have been pushed by government in many cases to protect against COVID-19. And so I would say that, of course, a healthy lifestyle is important. It makes your immune system more robust. Doing everything you can from a daily lifestyle perspective to keep you healthy will lead to a better outcome if you get COVID-19. But I think an important piece of context is that, the virus can spread to everybody, including healthy people, and that healthy people can unwittingly, especially with this virus, spread it to other people. And so for folks who are less healthy by their own lifestyle decisions or not, the context of the fact that if you are not taking these precautions, such as vaccination, such as masking, such that you may do fine with COVID, but you may compromise or harm the people who are closest to you, with whom you interact every day. And I do want to rewind a little bit on this question of politicization. Another piece of context is that the state of Mississippi, for example, I know this for a fact because we looked at it when I was health commissioner, when we were talking about possible vaccination policy here in New Jersey, has some of the strictest requirements for childhood vaccinations to attend school. In fact, there is no religious exemption as an option for parents for basic childhood immunization in that state. And this was at a time when this whole issue of vaccination was much less politicized and much less controversial. But we have been accepting of things that you have to do for public health as a requirement for employment, as a requirement for kids going to school for quite some time. And it's telling that that basis is no longer accepted now. And so it's not only accountability on folks who are skeptical of these evidence-based protections, because I do think it's people's responsibility to be informed to a large extent, but we also can't approach this from a platform of alienation on the side of folks who do have that knowledge. An example, in my hospital, there's a lot of vaccine skepticism in our own employees, and we've since implemented a mandate. But the way we've executed that mandate is such that I personally had meal after meal with hesitant, unvaccinated employees where I led off by saying, this isn't about alienating you. There are understandable reasons based on your own background, based on your own lived experience, to be skeptical of the medical establishment and to be skeptical of government. But here's why I think this will protect you, because I care about you. I care about the employees here. I care about keeping you safe. And it was really fascinating to see how many people, when they realized that as a management team here, which wasn't about alienating you and making you and bullying you into getting the vaccine. On the contrary, we're doing this because we care about the community and care about you in terms of protection. And I think if we talked about that more on the more progressive side of public health and public health messaging, we may get even more traction among the unvaccinated and people who are skeptical of COVID altogether.
Dr. Elnahal, I want to. Oh, I'm sorry. Go ahead, Dean, please.
Oh, yeah. I'd like to add, though, vaccines are a key preventative measure. They are the key preventative measure for getting us out of this pandemic. There are a number of other inputs that could also help, but they are the key to ending this misery that we're suffering worldwide. So, that I think that point needs to be made. Yes, nutrition is important, healthy lifestyle, smoking cessation, etc. But I think the key remain the vaccines.
Can I add something to what the dean just said, which is I think we've reached the point, I believe we've reached the point where we've gone from a pandemic to an endemic. And so now we have a situation that we have a virus that's going to continue to persist in our mix, that's going to probably result in, I don't know this with 100% certainty, but likely will result in vaccinations on a consistent basis. And so our way out of it is let's get more vaccinated people now. If we don't want this to be a behavior we have to take every single year or every few years.
And that's a perfect segue. So I was very curious, Dr. Elnahal, we've talked a lot about the disparities and some of the skepticism among Black and Brown communities when it comes to the vaccine specifically. But some of that skepticism, as you noted, is built on concerns that are based in reality, right? Actual gaps in care, lack of investment that are real and documented. What is, when it comes to investing in underserved communities and the health system and being ready to deal with, what is now an endemic disease, what does the next governor need to be thinking about?
Yeah, it's a good question. And the first thing I'll say is that the pathway here to the end game that we all want, which is everybody to be as protected as possible from this virus, is a pathway that lives or dies by trust. And so you're not going to build trust in skeptical communities unless you acknowledge and justify very legitimate sources of skepticism that are based in history. And that history is full of injustices toward people of color in particular. And this was a common thread in our hospital employees here to say, look at the Tuskegee experiment example. Look at the Henrietta Lacks example out of Johns Hopkins University that stole her cells without her knowledge and without crediting her and what she contributed to medical science. These are real, validated examples of how the medical establishment has harmed people of color throughout history. And so starting these conversations by acknowledging that history, but staying firm and saying it's actually a matter of equity to promote vaccination and get vaccination into the communities that have been hit the hardest, which happen to be communities of color here in New Jersey by this virus, has to be step one. And so I know that there's a commitment across both sides of the aisle to, at least acknowledge that. And I think that needs to be reinforced front and center, because it's really the only pathway to trust to some of the most skeptical communities. And it, again, speaks to the thread of understanding where people are coming from. It's not a matter of intelligence or being informed. It's a matter of trust and not believing what authorities are saying or what they read in the news. And you're not going to get that solved with alienation.
And it speaks to, can I add to this? And it also speaks to, I think, to what Dr. Al-Nahal is saying, to another segment of the population, which is, working class, white folks who have worked in coal mines and what have you, who have been felt that they've been deceived, forgotten by the federal government, that economically they've been disadvantaged because of policies and laws. And there's been a distrust of the government as a result of that. And so their distrust, different from Black and brown communities who have been abused and misused by the medical profession, is still distrust. It's a different source of distrust. And we have to acknowledge this 30, 40, 50, 60 years of the Rust Belt falling apart in the United States and say, this is why folks feel that way. And let's use a different approach, like the conversation Dr. Al-Nahal has been having with people in his hospital with folks who are of that population, because it's a different conversation that might help them get to the place we want them to get to also.
Dr. Rapoli,
yes.
I wanted to ask you how you move forward for medical students on something like that. Sorry.
So this is the perfect segue to that. So part of building trust is to diversify our workforce. And that's what we're trying to do nationally, so that we have two diversified culturally, people with cultural humility. But it's very important, and it's been actually proven that patients do better when they have providers who look like them. And that has been shown. So hearing messaging from healthcare providers, and I think that's very much a part of the building of trust that Dr. Al-Nahal brought up. So that is the goal nationally. It's supported by our regulatory bodies as well, that we work hard to diversify the workplace in all regards, including socioeconomic diversity as well, so that there are providers who have these skills and will have appeal to segments of our population that currently feel disenfranchised.
And I'm also go ahead, Brenda.
No. Go ahead.
All right, I was going to ask just quickly about long COVID, because I know that's a concern of a number of people. It's come up in questions to me. Dr. Al-Nahal and I have talked about the need to sort of prepare for that. I don't know who wants to take this on, but I'm curious, what is the state? And again, we could talk globally, but since this is an election based discussion, what does the state or the next leader need to do when we're talking about long COVID? What needs to go into planning for that? I don't know who wants to start.
Yeah, I'm happy to start, Lilo. So
thank you.
It's a really important public health problem that is only going to get worse, because in many cases, a lot of folks don't start seeing these follow-up symptoms from long COVID for weeks or even months after they have an infection. And so it's important to understand that this stuff can be insidious. The symptoms can be as, vague as mental fogginess, not even overt depression or mental health issues, but also a lot of physical health problems that can come. And so the first thing I would say is to have a lot of public health messaging around looking out for signs and symptoms of long COVID. A lot of what we do in public health is just informing the public about what to look out for in terms of risks. And we won't be able to do anything about this public health problem unless people are self-identifying and saying, hey, I have a problem here and it's creeped up on me over the last few weeks. Maybe I should see my doctor. And then the second part is preparing the healthcare system to address the symptoms and the diseases that come with long COVID, because we're actually, as a scientific community, still trying to understand and define how to rigorously diagnose long COVID. And then, of course, what to do about it in terms of treatment plans. And so preparing the healthcare system, funding the healthcare system to deal with the problem, and making sure that epidemiological research, like both deans on this call will certainly be participating in with their infrastructures, is super important for us to be able to tackle the issue.
We need what Dr. Nahal is, saying about research, and I completely agree with it. Is we need cohort studies. We need studies where we follow people for long periods of time to see exactly what's going to happen, including, and I'm going to say something that I've said to Brenda many, many, many times in our conversations: children. I want us to follow children who have been exposed into adulthood, because I am not 100% certain that there's not going to be some long-term effect. And this is another reason why we must protect our children, because we just don't know.
My understanding is that, go ahead, Brenda, sorry.
Finish.
My understanding is that that patient groups have also become very, very active in driving, especially the conversation around long COVID, and so I'm imagining that they have a role to play. Is that how do we do that in this state? I know a lot of that happens in the pharmaceutical industry, but is there a role in public health or in the healthcare system, a greater role for sort of patient advocacy? And again, I'm going to open that to anybody who wants to take it.
Well, yes. I mean, we did that during AIDS. It was called ACT UP. There's the model there. We were at the table with the FDA. We were at the table with the NIH. And so at a moment like this, it is incredibly important for patients and patient advocates to be at the table with all of the scientists, with all of the healthcare providers, to recognize what is going on the community level. The direction where we went in AIDS and the ability to actually advance pharmaceuticals and the ability to actually do clinical trials, not perfectly, because nobody did them on women at the beginning, right? What was advanced because activists were at the table. And so we need the same folks at the table right now.
There was a whole federally funded network, speaking of the HIV epidemic, there was a whole federally funded network based on community-based research studies that enrolled people traditionally excluded, women, persons of color, people who weren't your ideal research participants, people who weren't always able to make appointments, things like that, the CPCRA. And that drew a lot of community stakeholder input into trial design and was quite effective in advancing treatments and strategies.
I completely agree with my co-panelists. The only thing I'll add to this is because long COVID is, affecting so many organ systems, including the brain, including people's mental health. I think actively engaging the activists that currently exist in New Jersey around these issues, around New Jerseyans with disabilities, mental health, primary care access, will be critical because they already have the connectedness into government, into the levers of society that can do something about these problems, and then working with these patient groups directly that will form or have already formed in many cases in a collaborative way. That needs to be welcomed with open arms by the healthcare system here, and we'll certainly be at the table at University Hospital.
I wanted to shift the chat to campaigning, if we could. GOP candidate Jack Ciattarelli recently said, COVID-19 is not serious for children, which is something doctors have dismissed as inaccurate. Certainly, it's a simplification of what could happen to kids. Politicians often stretch the truth when they're out stumping for votes. What is their responsibility, though, to pursue the scientific truth in a public health emergency when they're out on the campaign trail? Harry, what do you think?
I think they are 100% responsible for advancing the truth. I think, I know politicians use data to their advantage, but, we know that clearly there are cases of children who are infected with COVID. We know, yes, for sure, that there are less deaths, and we own that. But to say that there are no deaths and no infection is simply false. And I think that the responsibility there for any candidate to manipulate data in such a way is irresponsible to the well-being of children in our state. And so what we have a responsibility to do is push back and put the facts out. And the facts are, yes, right now, with these variants, at their age, children don't seem particularly vulnerable to this disease. But, and just own that. And there's no shame in saying but, right? But to say no damage, no effect is simply, I think, the same way I think about masks, irresponsible for parents to send children to school without masks and put them in harm's way, irresponsible for politicians to put children in harm's way by saying they're not susceptible to this disease. It's dangerous.
No, this pronouncement, yeah, I totally agree, Perry. This pronouncement was very early, in the pandemic. And if you go to other states, there have been pediatric ICUs that were full, and children who have died. And then in addition, you have inflammatory effects in children that are well described. So especially in this phase of the pandemic, we're seeing children and unvaccinated individuals who are suffering hospitalizations, deaths, those key indicators. So, I think that the appropriate position on this would be to say, yes, children are at risk at this point, and to also protect them, though. And one way for others to protect them until they could get vaccinated is to get vaccinated yourself. Use the masks, etc. Use these simple precautions. The masks are very simple. People are used to wearing them now. And, these are relatively simple measures until, and hopefully we'll have vaccines available for younger children. The 5 to 11-year-old group will be next, and then eventually under that.
To follow up on that,
Brenda, can I just add one thing really, really quickly? I'm sure I keep coming back to HIV, but my head's wrapped around this book I'm working on that compares HIV to what's going on right now. And I just want to just use a line from the HIV pandemic to inform this, right? Which is, it's blunt. Oral sex is low risk, not no risk. And so here, it may be low risk for kids, but it doesn't mean zero risk. Zero risk means no child is affected, and we know that is not true.
That's a good point, because now parents are trying to weigh the risks, for example, of vaccinations for their kids. So what is the message that you want parents to hear when it comes to COVID, for example, with the vaccinations? There are trials now that are underway with very young kids. There's an emergency use authorization that's out for the 12 to 17-year-old group, as Dr. Rugoli pointed out. Has the messaging been consistent for parents? Has it been a little bit messy? What should they be hearing? Dr. Rugoli?
Well, certainly having been a parent myself and now a grandparent, I could understand, they always use the expression that children are not just little people. So I agree that the studies need to be done. They're in process. But personally, I can't wait until the availability of this vaccine for my grandson. And I think that, that will be a key piece. We've also seen other effects of this. So we talked a lot about the medical effects. We talked about the disparities, in outcomes. But one thing is, our children really can't afford to keep missing school.
Right.
And, sit out and be out. So the way for them to get back into all of their key activities, school, sports, etc., is when the opportunity to get them vaccinated comes up, that they get vaccinated. And that returns them more to their normal situation, because It remains to be seen what will happen with this cohort of students. They'll be a bit behind. They've lost time in school. They've lost social interactions with their friends. They've lost the ability to participate in organized sports. So the sooner we can also get them vaccinated, allowing for, the proper scrutiny of the studies that are going on in them. And, again, following the recommendations that the ACIP put forth, et cetera, these governing bodies that are authorities on vaccines in general, and are, the individuals that really analyze this data and look at it. But the sooner we could get things to a level where our young people will succeed again.
Speaking of children who are, especially those who are too young to be vaccinated, masking has become an issue, and the governor recently sort of reiterated he expanded the vaccine mandate around daycare centers, which have sort of been always considered, but sometimes a little bit after everything else, and he reminded the public that everybody in these facilities needs to be masked, including children as young as 2 years old. That set off some debate, particularly among Republicans, and some people are suggesting it's cruel. Brenda's, we've all seen these protests where people are saying masking is restricting their child's freedom of expression, or is somehow harming their child. I'd like to ask Dr. Elmahal, I'm going to start with you. As a physician, are there dangers to masking? What should parents know about masking, particularly young children? And it may seem odd. I know it's not easy. We all know that. It's not easy for adults to keep our masks on. But what are the sort of the clinical issues we should be thinking about?
Well, the first thing I'll say is I think Dean Riboli articulated this really well. The concerns that many on the right side of the political spectrum have raised around, the psychological effects of education from home and virtual education, and denying kids young as age 2 the ability to interact with kids their own age as part of their social development. Those concerns are very legitimate and frankly have scientific basis behind them. And so I think as a public health body of experts, we have to give appeals to that science credit, regardless of where it comes from in terms of political party affiliation, right? But that aside, we all now understand the value of in-person daycare and in-person schools. What she also said was, look, that doesn't come without risks, and it's our responsibility to minimize risks to kids, teachers, and staff in schools and in daycares. And that is best done through masking. Now, there are concerns about whether masking has an effect itself on social development. In my view, that is a matter of weighing risks, and we don't know what that risk is or whether it really even exists to a significant extent. And I think the governor's been pretty clear, and I think political leaders across the country have been clear, that this is not a permanent thing. This is while we have a Delta variant that is raging in society and is infecting younger kids too at a higher frequency and sending them to the hospital at a higher frequency. And so that logic to me makes sense. It's hard to articulate these nuances around weighing risks. But again, people in government are making policy around an environment of uncertainty. That's just part of the game. And I think the balance around requiring masks in daycare while having daycare in person and not compromising that, to the credit of people on that side of the political spectrum advocating for reopening of those institutions, is the right balance.
Children and young kids have brains that are plastic, that continue to form until age 25, biologically, physically, emotionally, psychologically, and socially. And all three domains matter equally. And so I ask parents who are having issues with their children wearing masks in daycare the following. Would you prefer your child to engage with their toys and the television set at home alone without a mask? Or would you prefer your child to engage with others with a mask in a daycare center where they can learn to interact with other human beings? I would bet, I know, in fact, the science would support this, that social engagement with other children their age will lead to better social development over the course of their lives, the establishment of healthy relationships, the establishment of healthy friendships, the establishment of healthy romantic connections. It's not going to happen at home alone.
I want to talk about tax dollars, your tax dollars at work. The federal government is making available literally billions of dollars to help finance recovery from the pandemic. Harry, you've talked about the historic underinvestment in public health and how New Jersey's public health system is so terribly localized. Well, I don't know if terribly is the right word. Local health departments say that they were understaffed during this pandemic. They were screaming for more money as they were enforcing lockdowns and doing inspections. So how did this overall impact our response, and what should voters be demanding from candidates, future governors, lawmakers in terms of funding for future pandemics so that we don't get caught in this again?
Yeah, so the parallel to me for this is when there's budget cuts in education, the first things that go are music and art, right? Because they don't somehow matter. Right? It doesn't matter. Who needs music and art? We need math and science. Clearly, we're not doing such a great job because most of America doesn't understand science. But nonetheless, let me get back to this. The first thing that goes when there's budget restrictions are things like public health, because it seems like soft science. It seems like unnecessary science. So what the voters need to be demanding, and I believe that local is really, really important. Grassroots is really, really important. What we need to do is take a hard look at all of our communities, all of our local health departments, assess what they have, and provide them the finances to build teams. We knew that some departments of health, and Sharif knows this, had really effective contact tracing in place already, like in Patterson. Others did not. It should be a consistency across our state, and you establish that consistency across the state by providing funds that allow each of these local health departments to have the type of people on board to let them do their work. The people in the local health departments with less money were scrambling. So voters need to demand public health money needs to be part of what we are providing in our state, both from a federal level and from a state level.
And I would add, in addition to the dean's comments, which I completely agree with, look, public health is underinvested in every part of this country, every state, nationally, regardless of the political party of whoever's leading those areas. I think if we have another pandemic or another epidemic within the foreseeable future, people will no longer give a pass to folks who didn't respond to the fact that we were clearly ill-prepared with public health investment now. And I think that accountability lies on both major political parties. Now is your opportunity to invest in public health. Look at the devastation of what happened as we are so underprepared for public health and with our healthcare infrastructure, especially the public institutions that form the safety net for the most vulnerable people in this state. Now is your chance to correct that. And in my view, as a resident of New Jersey, that will be a major thing for me as I am voting into the future about whether people seize this opportunity to do something about it.
We were underprepared when 9/11. I'm sorry, just really. I'm sorry to interrupt. We were underprepared when 9/11 happened, and it happened, and we invested a ton of money as a result of that. This is the 9/11 of this moment, right? And so we need to react in the same way.
Absolutely. I was going to add, it was said we're going to have other pandemics, okay? And it's not going to be 100 years between pandemics. Climate change, globalization, et cetera, the way we interface with animals, et cetera, we will certainly have other pandemics. So I ask the question, who will respond to the next pandemic? I think it's essential that we build our public health infrastructure and also our capability within medicine and nursing and allied health professions as well, that we really strengthen those, because that's where the response is going to be.
And staffing and training for nurses, for people who are working in nursing homes and things like that. We're dramatically understaffed all the way across the board. Should they be looking at training programs?
Yes, absolutely.
I mean, we've seen a huge increase. I mean, we've been seeing increase at Rutgers for years, but the rest of the schools of public health throughout the country have seen a huge increase in the last year of students interested in this area. We're getting some of the best and the brightest minds from America coming to schools of public health. Let's train them and let's deploy them to each of our counties and each of our towns here in New Jersey.
You know, we've had banner applications to medical school last year too, and it's called the Fauci effect, where people want to pursue, young people are very interested in pursuing medicine and public health as well.
I love it. I think we have time for sort of one more, and so we'll try to make this a quick one and get everybody in. But if you were to give voters sort of one piece of parting advice today, as they think about, you know, health and COVID and when they go to the polls, what would that be? Dr. Halkitis, can we start with you?
Yep. I would say to the voter, vote for the person who's thinking about the whole state and not about themselves. And I think that if you do that, you will make a choice that is beneficial to every single one of us.
Dean Raboli?
Yeah, I would agree. I would say vote for the person who's following the science and the evidence-based medicine.
And Dr. Elmahal?
I would say think about the hierarchy of needs for you, your family, and society more generally. There's a lot of frameworks around this, but every framework puts health and public safety near the top. If you don't have that, if you're bound to a hospital bed, if you are contending with long COVID and the disabilities associated with that and the chronic disease associated with that, you are not free to take care of your other needs and the needs of your loved ones. So look at the platforms of the candidates in front of you, not just for governor, but really every candidate, and ask yourself who's considering that your needs in the right order. That's my advice.
That's good. I think that's a great, I will thank my panelists, our panelists. First of all, thank you, Brenda. And of course, Dean Halkitis, Dean Raboli, Dr. Elmahal. And I'm going to turn it back to Steve Shallett in case he has any final parting words. But thanks for being here. And don't forget to vote, most importantly.
Dr. Halkitis and Dr. Raboli, this is an amazing conversation. It's vital that the people of the state can hear this topic taken into such detail with a range of thinking, because it's how we all arrive at our own individual sound thinking. So thank you so much for this extremely important input. We are going to have the next election conversation on Tuesday the 28th, and that'll be concerning budget and taxes, which will be moderated by John Reitmeyer and Rhonda Schaffler. We hope you can tune in for that. That'll be at noon on Tuesday, the 28th. You'll receive an email about that, and we hope you'll join us. The video from this event will be forwarded to all registrants, so you'll be able to see that in your inboxes in the next day or so. And I'd like to encourage everyone, if you have a few moments and would like to stay in the chat, and we're going to continue this conversation for a few minutes, hopefully with some of our panelists and certainly with our journalists, to continue to unpack these topics and your questions for a little while longer. And again, we so much appreciate your attention and your interest in these topics. And with that, we'd like to sign off of the video, and we look forward to seeing you again soon. Thank you so much from NJ Spotlight News.